we'll get started and see if other people join us. So I'm Jenny Castillo. I'm not sure if I've met everybody. I work at Columbia. I'm the director of wellness there, and also the co-chair for AWAEM's Wellness Committee. And I had seen Michelle do a presentation for I guess it was all NYP, New York Presbyterian, in a webinar a few weeks back. And I thought, that would be a really nice thing to have for AWAEM, just to kind of teach us some acupressure points and some information as to how to relax ourselves, even within meetings. So I'd like to introduce Michelle Bombacie. She's a program manager of the integrative therapies in the division of hematology and oncology and stem cell transplant. It was pediatrics, I believe, right, Michelle?
Yes.
Pediatrics. She's licensed as a massage therapist and an acupuncturist. So please welcome Michelle to our AWAEM little gathering tonight. So thank you everybody for coming and participating in this. So take it away, Michelle. Thank you.
Thank you so much, Jenny. And hello, everyone. Welcome. And I'm so honored to be able to spend this time with you this evening. I'd like to express my gratitude for all of the work that you do every day, and especially over the past 10 months. I think we've all felt the physical and the emotional effects of this year. And I think that working in healthcare without working in a pandemic brings stressors. I think life in general brings stressors. And so I'm grateful to be able to share with you some self-care tools that you can practice anywhere, anytime. They're quick, easy tools that you can just, practice by yourself, with a group, before a meeting, after work, with your family. Just acupressure and visualization are the two modalities that I'm going to teach you this evening, and we're going to practice together. And there are two techniques that I use on a regular basis, both clinically with my patients and for myself. So before we get started, I'm just going to give you a little bit of a background of the work that I do. And as Jenny said, I work in pediatric hematology, oncology, and stem cell transplant. And I manage the integrative therapies team, and we provide complementary and integrative health modalities to patients and their families, both in clinic, inpatient, and in the emergency department at Columbia University Irving Medical Center. And we also extend our services to staff, both in person and also virtually. So let's start. I'm going to share my screen. Okay, so we're going to start with some acupressure that will help alleviate stress and boost your immune system. I include the immune system with the stress relief because, as we all know, chronic stress can have a negative impact on our immune systems. So, just going to move this over here so that I can see. Okay, so acupressure is a system of integrative medicine based on the principles and philosophy of traditional Chinese medicine that utilizes specific points called acupoints. These acupoints are located along energetic pathways known as channels or meridians that run through our entire body. Qi, our vital life force, is what flows through these meridians. Acupoints have more than one action. They correspond to a specific body part, system, or emotion. And by applying medium pressure directly to the point and holding it for about 15 to 30 seconds, you can access an area in the body. You can elicit a change in the body. And if you see this diagram here, this colorful energetic pathway, all of these meridians also correspond to our organs and originate in the hands and feet. So they run the course of the entire body. Let's start with Yin Tang, and I'm going to invite us all to find a comfortable position. If you can make sure you have, just a position where your feet are on the ground and you're relaxed, shoulders are relaxed, chin slightly dropped, and take a deep breath in through the nose and exhale. Okay, and I'm going to invite you to take one finger or two fingers and place them in between your eyebrows at the glabella. And you're going to apply a medium pressure. And you can take a deep breath in through your nose and exhale through your mouth. And as you apply this pressure, you can start moving your fingers in a circular motion. This point, Yin Tang, hall of impression, helps to calm the mind. So all of our racing thoughts, our tension headaches, our anxiety and fears can become slightly less intense by applying acupressure to Yin Tang. Okay, our next point is called Zhang Ren 17, which is chest center. As we all know, when we feel stressed or anxious, sometimes we tend to bottle up our emotions and they get trapped in our chest. So this point is located midway on the sternum, and it's about level with the fourth intercostal space and our nipples. And usually if you palpate down your sternum, you might find a tender spot. And acupressure points are within depressions of bones. So you'll usually feel your finger just slide into that point. And when you feel that you've found the point, you can apply a medium pressure with one finger and start moving your finger in a circular motion, taking a deep breath in through the nose and exhaling through the mouth. One more deep breath in through the nose and exhaling through the mouth. Okay, our next point is called Xiao Fu, which is heart 8. So it's located on the heart meridian, and it helps to treat palpitations, fear, sadness, worry, fear of people, or agitation. So this is a great point because nobody needs to even know that you're actually applying acupressure to the point if you simply keep your hands in your lap. In order to find the point, I'm going to ask you to just create a loose fist. And the point is where the tip of the pinky finger falls into a depression on the palm of your hand. And then with your opposite hand, you can apply a pressure to that spot. And if you rub it a little bit, with a little bit more pressure than you used for Yin Tang or Ren 17 on your chest, you might feel a really tender spot in the palm of your hand. And you can just place your hands in your lap and apply pressure, taking a deep breath in and exhale. And then you can start maintaining the pressure to the acupressure point while including a circular pressure. These acupressure points are useful, as I said before, for self-care. And also, they're very easy to apply to someone else and teach someone else. Okay, moving on. Taiwan Lung 9, Supreme Abyss. So this point can be a little bit tricky to find, but it's at the wrist joint and it's in the depression of the radial artery and the tendon of the abductor pollicis longus. So usually what I'll do is on the pollicis side, I'll abduct my thumb and feel for the tendon. And then I'll use my index finger so that I can feel the radial pulse. And I'll just slide my finger right into that depression. And this point, because it's on the lung meridian, also helps with the immune system, coughing. It gives us a little bit of an immune boost and it strengthens our lung qi. So Yin Tang Ren 17 and Heart 8 were all points to help calm the emotions. Lung 9 is a point to help boost the immune system, strengthen the body so that the chronic stress doesn't get to you, helps to prevent the chronic stress from making us ill. Okay. And stomach 36, which is located on the leg. Okay, so it's on the lateral portion of the shin, and it's just below the kneecap, the eye of the knee, and the location is 3 sun inferior. Sun in acupuncture is a measurement used to locate points, and 3 sun are actually 4 finger widths, 4 fingers. So if you find the lateral eye of the knee, and then you measure 4 finger widths down, and then you fall into a tender spot on your tibialis anterior muscle. You should feel that point. And it's called Zusun Li, leg 3 miles. This is also a good immune boost point if you're fatigued. And because it's on the stomach channel, it also does help with indigestion, edema, or muscle pain in the leg. And take a deep breath in and exhale. Okay. So now we're going to go to our visualization portion of our experiential workshop. So visualization or visual imagery is a practice of imagining or creating an image in your mind and holding that image for a specific effect. So preferably creating an image in your mind or a memory or a place where you feel tranquil or serene, and visualizing how it feels to be in this place, emotion, or situation. So it's a mind-body discipline that can be readily integrated, and it bridges the mind-body, the brain, mind, and body directly by promoting relaxation. So oftentimes I'll think of acupressure as a physical, energetic self-care tool, and then the visualization is the emotional, mental self-care tool. So practicing those once a day for even 2 minutes a day will help relax both the physical and the emotional well-being, will increase both the physical and emotional well-being. So I'm going to stop sharing this slide now, and I'm going to invite us all to sit in a comfortable position. And your legs can be crossed or your feet can be on the ground. And you want your spine to be straight but relaxed. Check in, see where your shoulders are. Make sure they're not up to your ears. Check in with your hands. We use our hands so much all day. They work so hard. Just let them relax in your lap. You're going to drop your chin down. Take a deep breath in through your nose and exhale through your mouth. And I'm going to ask you to visualize a place, an emotion or event or a person that you feel calm thinking of or tranquil. That could be walking along the beach in Hawaii for some, or in the woods for others. It could be walking your dog or hearing your cat purr. It could be taking a bath. It could be smelling flowers or eating a fresh piece of apple pie. Just something where you feel calm and helps you get away from your busy thoughts. Take a deep breath in through your nose and exhale through your mouth. And how does that place, emotion, or thing smell? You can close your eyes, and if you keep the tip of your tongue on the roof of your mouth, you won't be able to clench your jaw. And just keep visualizing your object. And if you're having difficulty remaining on the object, you can focus on the breath and just feel the breath enter your nostrils. And then let the breath out through the mouth. So breathe in relaxation. And exhale out, letting go of the tension. How does that place feel? Does it feel warm? Do you feel a breeze on your skin? Do you feel joy thinking of this place? If you were to taste it, how would it taste? How does it sound? Is there water? Are there leaves? Are there children laughing? And if you were to touch it, what would it feel like? All the while breathing in through the nose and exhaling through the mouth. In traditional Chinese medicine, there's a saying that the qi follows li, and li, Li, is our thought, and qi is our energy. So therefore, if qi follows li, if our energy follows our thoughts, we eventually manifest those thoughts because our energy will go there. Taking a deep breath in through the nose and exhaling through the mouth. Breathing in newness. Exhaling out old, stagnant energy. Breathing in light. Exhaling out dark. And one more time, breathing in calm and exhaling out tension. And if you had your eyes closed, you can open them now. And just take a moment to see if your body feels more relaxed than it did before applying the acupressure and the visualization. So really the practice was about 20 minutes in length. And they say that's all you need to elicit the relaxation response. 20 minutes, finding 20 minutes in our day can be difficult. So even just taking one of the acupressure points and sitting for a few minutes or taking a few deep breaths, giving yourself self-care, pampering yourself a little bit. You can have fun. Self-care can be fun as well. It doesn't have to be serious. It's kind of funny, you know, to be pressing and visualizing how something smells. Enjoy the time that you give yourself. And I'm happy to answer any questions that you might have. And we will send out, I think we can send out the slides if you'd like to have the image of the acupressure points.
That would be great. Thank you. That was wonderful. Can I ask a question?
Michelle, thank you
recommend-
so much.
Yeah. What do you recommend for short time periods? So if you didn't have 20 minutes, but you had 5 minutes or 3 minutes, or I know some people on shift will take like 1 minute and do some sort of relaxing meditation type exercise.
Yeah, I would definitely just sit for a minute or just find a place where you're alone for a minute, and I would apply an acupressure point. So you can apply an acupressure point, one on your hand or the Yin Tang, and to include the deep breathing with that, because even 1 minute of that will help you ground and just help you get out of that racy, busy moment.
Thank you.
Michelle, there was a question in the chat. If you're not sure where the point is, can you do harm?
Yeah. You know, that's a great question. If we were doing acupuncture, I would say yes. But acupressure, actually the acupressure points are about a quarter, a quarter, a quarter in size. And you really can't do harm, because you would feel if the point is too tender or too painful, you could modify your pressure. And if you if it felt uncomfortable, you could just move your finger slightly over. But I don't feel that acupressure can do harm. That being said, there are certain acupressure points that are contraindicated in pregnancy. And I did not teach any of those this evening. But for example, a very common headache point, it's called Hagu, large intestine 4, and it's the point that's in between the thumb and the index finger, in between the in the web there. I'm sure you've all heard of this point for headaches. So this point is actually contraindicated in pregnant women because the indication for the point is to encourage quick circulation. So, so yes, if you were to do a contraindicated point, then you may possibly do harm, but otherwise the points span a broad space. I hope that helps to answer your question. And in any of my slides, I indicate any contraindications.
Another question, how do you use this for ED patients?
You know, that is a great, great question. So we actually work with Dr. Shulin Shah in our pediatric ED. She is also an acupuncturist. And we usually access the ear. So we provide auricular therapy because in the ED, there's so much happening, as you know, and sometimes it's difficult to access points. So just by massaging the ear, I didn't get into it this evening, but the ear is a microsystem of the entire body. So just by massaging the ear, you're accessing some points that can help elicit relaxation and are very calming. Or you can simply instruct a patient to take their hand, put it between their eyes, and apply circular pressure, or you can actually apply the acupressure point. All of these points that we practiced together this evening are easily accessible points that can be done over clothing. Like I said, because we're not using acupuncture needles, we can do this over clothing.
Wonderful. And another question, where there is laterality, does it matter which side you do, or do you need to do both sides?
Yeah, so all acupressure points are bilateral except along the midline. So for example, the Ren 17 point is not bilateral, or the Yin Tang point, but the heart 8 and the lung 9 and the stomach 36 are bilateral. And when applying acupressure, you don't have to do both sides. If you have the time to do both sides, that's wonderful, because one of the main philosophies of acupuncture, it works with the traditional Chinese medicine theory of yin yang. So it really works to create balance. However, applying acupressure to like left lung 9 and right stomach 36 is also considered balancing, because you're applying an acupressure to something on the left and something on the right, something upper, something lower. So I hope that answers your question. It's not necessary to apply acupressure bilaterally, but you can.
Those are great questions. Is there any other questions? I don't see any other questions in the chat right now. We are a little bit over, so I want to honor people's times, but I think that's about it. Thank you so much, Michelle. That was wonderful. And I'm ready to kind of slide into my bed now, relaxed. Thank you. And actually, I'll tell you, my daughter is doing it behind me too. So,
Oh, wonderful.
she's 13, and so she's going to start now also sliding into bed. So thank you. Thank
Well,
you very
thank you
much.
so much for having me this evening, and it truly was an honor. And there are a lot more acupressure points in the body, but these are good 5 points to start with.
Wonderful. It was exactly what we need. You know, emergency medicine people are very very focused and need things that are quick. And those are extremely helpful that we could do even while sitting and charting or, listening to a presentation. So it's
Quick,
awesome.
easy tools.
Wonderful. Thank you so much. Okay. Well, thank you, everybody. Good night, and have a safe and good evening.